My name is Aurelie Tran, and I am a first-year medical student and one of the clinic directors for the UofM Student-Run Free Clinic.
And my name is Arushi Mahajan. I am also a first-year medical student, and I do internal operations for the clinic here.
You talk briefly about what you mean when you're talking about a community clinic.
Yeah, absolutely. So I guess the idea came up seeing a lot of the struggles we were having with our patients at the free clinic. It's a generally low resource area in terms of healthcare for folks on Medicaid or Medicare or people who don't have insurance. So we wanted to be able to have a space that incorporated community building, putting skills and resources in the hands of the community that we're serving, and having this all in one location so that it was more holistic than just a medical visit or just a social work visit, just to acknowledge that people really have a lot of different components to them, and that we can support all of that with the resources that we have. So since we already had healthy habits happening at the library, we knew this was a lovely space that was already doing so much for the community, and so we thought it'd be a wonderful opportunity to partner and try to use this as a space where we can team up in providing holistic healthcare services to the Pinckney and Livingston County community.
And when you're talking about holistic, what does that entail?
Yeah, so providing medical services, doing certain medical consultations through the medical school and the nursing school. We have social workers coming out to do interventions with people, to talk through any resource needs that they might have. We have insurance counselors, we have legal support, legal aid, and we have pharmacy people doing medication things, dentistry, so a lot of different diverse people providing a whole wide range of services. The free clinic space is one that's not consistent. We have different students volunteering every single week. We're open Wednesdays and Saturdays weekly, but what happens on each of those days is completely different week to week. So we're not able to follow up with most of our patients because they're seeing someone new every single time. And a lot of our patients have so many different health conditions and needs that that follow-up piece is what's really important beyond just meeting them for the first time. And aside from that as well, the clinic itself is a very traditional looking medical space, and for people who've been going through a lot of things, it isn't a very welcoming place to be, and it's a very small town and everybody knows each other, so coming into the clinic to get your health care or whatever other needs you might have isn't always the best option for people, and so people do kind of get a little turned off by that. So it's wonderful to have a place where people in the community already value so much, and that it's a non-intimidating space, and we're able to provide that follow-up aspect, but also just like a more nurturing environment for people who are already going through so much, and we're not able to do that at the clinic now.
And Arushi, what would be your role in this community clinic?
Right, so I think to best answer your question, I would like to draw on the principle of peer-to-peer communication, which is something that I think both of us and everyone at the medical school really values. Typically, when people think of a medical encounter, it's usually someone doing the teaching and the patient doing the receiving. Whereas we'd really like to emphasize that in order for people to achieve their best form of their own health, a lot of that can be intrinsically driven and through conversations with people who are experiencing similar life situations.
So why the Pinckney Library?
Sure. So Pinckney is a community that the University of Michigan, via the Free Clinic, has an established relation to. So our students over all 4 years and our interprofessional partners, like those in the nursing school, have all come out to the clinic and had some exposure to the city, which I think that all of us can say very easily we're very grateful for. And so despite the fact that some of these relationships aren't longitudinal, I feel like all of us feel some kind of bond with the community. And so in regards to picking Pinckney as the city we want to work in, there was no second thought about it. To answer the second part of your question, why the library? Growing up, I think we both experienced, and many of us have experienced, that the library was really the heart of a community. And I feel from our conversations that the Pinckney Library is the heart of your community here, and it's very close to the clinic, and so on a variety of levels, it makes a lot of sense. And by your blessing, we're really grateful for the opportunity to work via the library.
I know that this is going to be like the first time that we're going to be doing this, but how much of a responsibility do you feel like the library would have to, like put in towards this community clinic that you're thinking about?
Yeah, I think the beautiful thing about this model is we already have the established resources and infrastructure and policies due to the fact that we're an established clinic. So really, on the library's end, it's providing us with the just support morally and the blessing for this project, as well as the physical space,
Yes.
the setup, things like that, is really on the library's end where we see this going, as well as distributing publicity that we can provide as well. So I think in that sense, there wouldn't be too much extra responsibility on the library side, and hopefully we can bring everything in and make sure that we're not putting an extra burden, since the library already does so many things.
And are you opening this up to the public, or is
Yes.
this like by appointment only? Or?
Yes, so this will be on a drop-in basis, and that's also a big difference from our clinic. So our clinic does have a couple hours a week that's walk-in, but it's on one day, and if you can't make it for those 2 hours in the week, that's it. And otherwise, appointments take 3 months on average to get. So this is going to be open to anybody in the public. They don't have to be a prior patient of ours. They also don't even have to live in Livingston County. If you're someone who comes to the Pinckney Library for whatever reason, you're welcome to get whatever services and as frequently as we're here.
And as the name implies, it's a community clinic, so we're hoping that the people who come will develop a community amongst themselves. And so through communication with their own friends and hopefully through our communication, that community will just grow continuously to whoever's interested.
Yeah.
So what do you think that having a community clinic like this would be a benefit for the whole Pinckney community and, and the service like the service area that we have?
Right. So the UofM Student Run Free Clinic is currently the only free clinic in the entire Livingston County. And Livingston County it doesn't have the lowest percentage of Medicaid and Medicare users and recipients in the state of Michigan, but there definitely is a large population of underserved people in the county. And so being able to create another avenue where people can access free healthcare, and not just free healthcare, free legal support, representation, social work, all of these other things that are also very hard to come by, it's especially dentistry, which is something we're working on as well. These are already resources that are so limited, and knowing that we have kind of opened the door as that one access point, since we are now at a point where we have the bandwidth, we hope to expand that to create even more access, and so it's easier for people to take care of their own health.
Perfect. Is there anything else you want to add, just that we didn't cover?
I mean, I would just say that we're immensely grateful for the opportunity and the means that you have given us in order to continue this, and hopefully it'll be a mutually beneficial relationship between the clinic and the community. Something we hope to grow in the future.
Thank you. Hey, all right.